Hello everybody! Tudo bem, pessoal? Como estamos no dia de hoje? Vocês conseguem me ouvir? Responde assim, eu ouvo. Se estiver me ouvindo, se estiver me vendo, eu vejo. Vamos ter que usar o vejo, não tem outra palavra. Mas se estiver me ouvindo, pode responder eu ouvo. Muito bem, muito bem. Todo mundo me ouvindo. Ou vejo. Muito bom, Kenji. Alright. As we know... Oh, the song name, okay, it's Linkin Park. Burn It Down. It's live from... What's the name of the album? One More Light. One More Light Live. You can find it on Spotify. I'm looking... Oh, this is very weird. As I look into the chat, like I'm completely looking to the other side. It's confusing. Anyways, how's everybody doing? Let me say hi to everyone here. So we have Bruna. Hey, Bruna. Solange, Sônia, Maria, José, Tatiane, Kenji, Cris Silva, Edileuza, sobrinho. Não é sobrinha, não é neto, é sobrinho. Nós temos... we also have Kelma, Ana, Lily, Valério is also here. There we go. Is we, Valério. Tami is also here as always. José Batista. Hey, José, how's it going? Ricardo, Isana. Cool, very cool. It's great to have you here. So as we usually do once a month, I'm here again. And this is all in English, okay? So I'll try and I'll speak as I usually do, which is not very fast if you compare to Erika. Oh, Erika is here as well. So, Paulo, hey Paulo, how are you? Arnaldo, hey Arnaldo, good to have you here. So this is in English. It's our monthly installment where I come and bother you guys. I'm very excited about this one because even though I kind of like I've been living this thing for the past 8 years, I still struggle to understand it, you know? So let's see how that goes. We have a lot of numbers to look at because, like, I just don't want to talk about how things actually work, but I want to be able to give examples so you can better grasp the workings of the thing, health insurance. So I'm gonna try and quickly go a little bit through how it works so we can get to the numbers where it gets more exciting. So here's how we're gonna do. I'm gonna go over the presentation, and if you guys have questions, please send them. I hope that I can address all of them. There's a lot to be discussed around this. There's a lot of edge cases, a lot of exceptions, if you know what I mean. So let's see how many we can address. And maybe there's like a follow-up that is needed. You guys are going to decide that once we get to the end. So let me start sharing my screen. Oh, cool. So, yes, you guys can see my screen. I assume you can. So as promised, we're going to be talking about the medical care or the health insurance system in the US, which is the source of a lot of critics in the whole world due to its almost private nature. So for us to get started, I'm going to talk about the importance of having health insurance. You guys know what health insurance is, right? So it's the magical coverage, is making sure that you can have access to healthcare if you need, right? So as a Brazilian, there's a few disclaimers here. So as a Brazilian or people from other countries with different systems, we take for granted access to healthcare when we're traveling abroad. So I don't know how many of you have had to know the chance to go in somewhere else, like outside of Brazil, and had some sort of accident or needed to get in touch with like medical professionals. I don't know what your experience was, but if you had some experience like that and you didn't think about it beforehand, I hope everything went right. But depending on where you went, chances are that you had some headaches coming from that. So in Brazil, we kind of take it for granted because we are born in a country that to some extent offers public health care. So if you have like a medical condition, you need help of a doctor, you can just go into like a pronto-socorro, right? Emergency room, kind of, and be seen and get help from a doctor. But this is not how it works, as I said, everywhere else in the world, especially not in the US. So let's compare it to the Brazilian system and see if we can learn a bit more about how the health system here in the US. March on. The first thing is quickly review Brazilian system, make sure we are on the same page, right? So the Brazilian system is designed to have one of the three important components of a health system, which is it's universal. Technically, everybody has access to health system in Brazil, and that is done by SUS, right? Which is Sistema Único de Saúde. In theory, if you have a problem, you can go to a public hospital, or there's like other places like AMA and Postinho, I don't know, like all the official names for that. You can have private insurance if you don't trust the government, if you don't think it's good. You can also have the choice of paying for it. So buying through like a private company, like Unimed, SulAmérica, there used to be like Bradesco, Seguros. There's a bunch of companies that offer that kind of private service if you so desire. And that gives you access to private hospitals that are managed by private companies. Some concepts that we have in Brazil, they also mimic the concepts we have here in the US. So I'm going to try and draw that analogy whenever I can, but not all of them, right? So you're going to listen about deductibles, out of pocket, maximum out of pocket. I don't know that those are present in the Brazilian system. And if they are, you usually don't care much about it because it doesn't take, I think, it doesn't affect so much your choices when you're thinking about healthcare, right? So moving on into the US health system. As a general statement, right? So this is very general, very broad. There is no universal coverage for health in the US. So not everybody has access to health system in the US. For you to get access to the health insurance health system in the US, you kind of have two main ways of doing that. One is through private health insurance, which is what we have also in Brazil. And the other is through government programs that offer health insurance for some people, right? So again, there's no universal access. You have to join the programs through a private party or government health insurance. Does that make sense? Let's start get a little deeper in each of these types, right? I'm gonna kind of start broad, go deeper, then I go broad again, and I go deeper as we investigate each of these types. So when we talk about the private market, there's mostly two ways of getting insurance. Either through employer-sponsored programs, which is how, I don't know, 90, maybe 95% of the population that are insured, they get their health insurance from. That means that you have to be working. If you're not working, and I think that's like I said, 95% of the population who has insurance coverage, they do because they are working and they are getting the insurance plan from their companies. Their companies are paying for that. This is one option. The other option is through the individual marketplace. If you guys been following the news from a while ago, I don't exactly remember what that became true, but I think it was maybe in 2008 or 2012 when Obama was president. They launched a law that is called, the official name is the Affordable Care Act, ACA, but people used to call it Obamacare, if you heard about it. So we're going to talk about that. So the Obamacare, or ACA, is a federal law that went into effect, and the goal was to be able to offer health care for all Americans through private marketplace. So essentially, it is forcing people to buy health insurance. So if you get health insurance for your employer, you're good. If you don't, you're required to buy insurance from a private company that is in the open marketplace. That is not, I don't know if it sounds like it's easy, but it's not, because here is the thing. Health insurance is expensive. We're going to talk about numbers. But when you're employed, your employer, right? The person employing you, they pay for everything or for a part of it, like at least like for a big chunk of it, just like they do in Brazil, right? I think that most of you who have health care, I would guess, if you have private insurance, is because you get it as a benefit from your employer, your company, right? Here, that is not required. Employers, I think, maybe if you're big, you're required to offer some sort of health care, but it's not a required thing. So you have the individual marketplace where you can go and buy directly from companies like you can do in Brazil, but it's very expensive. So let's keep moving. If we're starting to break down like employer sponsored, there's a few choices of plans that we're quickly gonna go through, just as so you understand a little bit better. But I'm not gonna go too much into details because they are kind of equal but different. There's like variations here and there. So the basic one, option one, is to get a HMO, right? Which is a program where a big insurance company, they partnered with a bunch of providers. So this is another terminology you gotta learn. So if you wanna go talk to a doctor, we refer them as a provider. If you go talk to a therapist, it's a provider. If you're gonna go take a test, that's a provider, right? So that's the terminology for the people who associate with insurance plans. So you have to pick one of them. And in this case, if I'm not mistaken, it's talking about the PCP, so the physician that sees you before anyone else. So you have to establish care through a physician, and they can refer you to a specialist if that's needed. So this is one fundamental difference with Brazil as far as I can remember. In Brazil, it's very common for you to schedule an appointment directly with a cardiologist, for example. Here, that's not how it works. You first see your primary physician. They are usually following you your whole life. So, for example, since I moved here, I have my primary care doctor, which is Dr. Banu. She's been seeing me since we moved here to North Liberty, which was in 2017. So every time I have like something that I think is a problem, I do not go directly into the specialist. I book an appointment to see Dr. Banu, which is my primary care physician. If it's something that she cannot address, she's gonna send me to another doctor. So that is important because if you don't do that, the appointment is not covered by the insurance. So that is the first difference, I think, that is important to call out. After we get the HMO, so there's like, that is one type of insurance that you can get. There's the PPOs, right? So these companies, they have also a network of people that you can use, of providers, and they don't require you to see a PCP first. So technically you could schedule an appointment with the cardiologist, and that would be kosher, that would be cool from the insurance plan perspective, right? So both systems are very similar, like HMOs and PPOs, in what they offer you. And it just varies of how you make those appointments, like if you need a referral or not. Cool beans? Then we start to be, it's a referral, Eduardo Kenji. So encaminhamento is a referral, or indicação, you know? So you're referring someone to a different type of provider. So HMOs and PPOs, very open. There's like the network, it's very flexible. There's like a lot of choices. Usually it's insurance companies partnering with every provider out there. You know, everyone. It's like if you're, I don't know, Bradesco. Everybody accepts Bradesco, right? It's very open, very broad system. The other one is the EPOs. This is when it starts to be a little bit more restricted, right? So this is one of those plans where you can mostly see the folks in network. In network are the usually it's a provider that has their own network. So in Brazil, maybe an example would be Prevent Senior, where you can get care as long as he's using one of their doctors, right? You cannot go to a doctor that is not part of the network and be seen. And also Prevent Senior, as far as I know, it's very restrictive, right? Like you gotta go to their hospital, their clinics. You cannot pick where you take exams and do tests. You have to stay within the network. So these companies here in the US, they are huge because of course you have to have your own doctors and everything. And patients can only access the doctors within the network that are managed by the company. There are exceptions, like for emergencies, for example. If it's an emergency, you can go to any hospital, but if it's kind of a routine thing, you have to stay within the network. Finally, we have these POS plans, which I'm not very familiar with, where you choose like your primary providers, and if you choose to go out of the network, you can still go, but it's more expensive. You pay more if you decide to go through this path. Okay, so there's like a limited network, and you go, you can go out of that paying higher. Why there's this variance? So we kind of saw four different things, right? So HMOs and PPOs, EPOs, and then POS. HMOs and PPOs, they are gonna offer you more options because they make the insurance companies, they are not medical companies, so they just partner with providers. And they're gonna be usually a little bit more expensive. If you're working with an EPO, they have their own network, so they are insurance companies at the same time they're medical providers. So you're limited in there. It might be a little bit cheaper because you're within the network. And then you have POS, which is going to be probably more expensive due to having like super small network. So I would be careful of getting these kind of plans. Moving on to government programs a little bit because there's a lot for us to go through. So if you don't have a job and you cannot pay for a private plan from the marketplace, you still have some choices. You can go through Medicare. So everybody that is working, they pay a monthly Medicare tax used to fund these programs, right? So I'm a worker. I pay like however much a month. So people who cannot afford can get money to using this program. So Medicare is a federal program like SUS is in Brazil. And it covers people who are old, 65 and above. So if you're old, you qualify for Medicare. So that's usually cares for retirement, you know? So whatever people pay every month goes into this government fund that is used to fund the medical care for old people. That is one program. The other one, which has a very close name, is Medicaid. So this is a state and federal program that also helps you get access to medical system if you're qualified. Usually it means that you make very little money, right? So I think it's, I don't know, 15,000 a year. If you make like less than, I don't know, 1,000 and a bit per month, usually is what you qualify. It's necessary to qualify. So like children, like low income people, I think there's depending on the state, some other groups can get access to Medicaid as well. So for example, if you suffer an accident and you cannot work anymore, so some states will make you qualify for Medicaid so you can access insurance without qualifying for the other stuff. Some states cover and give these programs to to pregnant women, for example, and there's probably other groups that are covered by this. But essentially, again, let's come back to this. That we've seen everything. Private and government, right? Government is for poor people and special needs groups and old people above 65. Private is for everybody else. On private, it's either through your job or you pay out of your pocket buying a private plan. That would another example of you doing this is if you're self-employed, for example, you have your own company or you work as for yourself, you would buy insurance through the marketplace and not be tied to a job. And then we talked about like the 4 types, which I already covered. Okay, so let's deep dive into the terms that get people confused, right? So let's talk about nomenclature for pricing. The first one is the premium. Can anyone guess what the premium is? If you have a car insurance, you might be familiar with this name, even if you don't know very much what it means. So the premium is the amount you pay every month, whether you use the system or not. So it's the mensalidade, right? So the premium is the money that it doesn't matter if you use or not, you pay every month. And the premium can vary based like on your age, where you live, if you're I'm gonna get to that, Valerio. If you're working or not, so how much your employer pays, so that tells you how much you're gonna pay. So remember that name, that is the premium, it's the mensalidade you pay, right? Next one, deductible. Oh, this is very interesting. Is there anyone who can guess what a deductible is? I don't think we have that in Brazil. So I'll pause for 6 seconds until you can answer. Okay, no answer. I mean, maybe you're typing, right? I think this is unfair. But anyways, the deductible is the amount that you pay before your insurance starts helping you. Does that make any sense? So, oh, I have insurance and I pay the premiums every month and I still have to pay stuff, like for stuff? How does that work? That doesn't make any sense, right? But that's actually how it works. So the deductible it's not carência, Kenji, because carência would be the time you have to wait until you can access the service. And I don't know what the word for carência is in English. Let's see. I don't think we have that. I don't know. I need to find that out. I couldn't find with the first Google search. So deductible is we're gonna get the example, but say that you pay like a few dollars a month per as the premium, and you have a $2,000 deductible. Then you go to an appointment or you do a surgery, right? And the surgery costs $10,000. So you have to pay the first $2,000 towards those $10,000. So the insurance only starts paying once you have reached the deductible. So that it's really an insurance. Like it's not like we have in Brazil where getting care, once you're paying the premiums, it's free. Right? Okay, I'm just paying like the mensalidade. I go to a hospital and I don't put my hands in my pocket. Everything is free, right? That's not how it works. Here, even if you're paying insurance, there's a given amount per year that you have to spend on top of the premiums before the insurance helps you. So keep that in mind. We're going to use that in the final number accounts, the accounting we do, right? Then we have another term, which is co-payment and co-insurance. I think they are interchangeable, like they are synonyms. This, it's a little bit more common in Brazil. Are you guys familiar with co-pay and co-payment? Do you guys know this already? Do you have co-payments in your insurance plans? Yeah, Ana. Okay. So the deductible is franquia. Very good. So deductible is the franquia, right? So franquia is very common. Deductibles are very common. So okay, this is very cool. Thanks for this. So it's very helpful in that context, right? If you total a car, so you pay every month the premium. If you break your car, the insurance will help you, but you have to pay the deductible or the franquia before you get the whole thing paid, right? So the same works for health insurance. But there's also the copay, which is coparticipação, which is a fixed amount that you pay every time you go to the doctor, even after you're paid your deductible, right? So it will be another level of franquia, another level of deductible. So again, depending on your plan, if you remember, I had like HMO, PPO, EPO, blah, blah, blah. And depending on the details of each plan, the amount of deductible varies, and the amount of copay and co-insurance, they also vary. Sometimes it's like a fixed fee. Sometimes it is like a percentage of the service. So that depends on the plan you have. But again, it's yet another layer of things you have to pay, right? So let's get to the last, I think there you go. The last concept terminology that is important for us to understand the billing system of medical system here in the US, which is called the maximum out of pocket. Does that make any sense to you if you read just maximum out of pocket? So, as it explains, right, this is the maximum amount that you ever gonna spend in that year in healthcare. So we're gonna see on the calculations later, but this is the final limit, right? So if we rank, we have the premium that you pay every month. You have the deductible that is a fixed amount that you every time you use, you pay a little bit towards that before insurance helps you. Then you have the copay, and it doesn't matter if you have deductible or not, the copay you always pay. And finally, after all of that, right, if you have reached the maximum out of pocket, then it's free. So we're gonna see the numbers, but what happens is you meet your deductibles, so the franquia. You still have to pay the co-pays up to the maximum out of pocket. After the maximum out of pocket, you don't pay for anything else for that year. So it's important to call out that the premium amount that you pay every month doesn't count towards the maximum out of pocket, right? So those are two separate costs that we're going to see how they roll up to the numbers. So when do you pay? No. There we go. So I'm going to get, yeah, I thought this was out of order. So keep those terminologies in mind. So when do we pay? This is also interesting. For us to pay, it's not very clear. I never know when I have to pay for these things, right? So when you go to the provider, so I go to the ER or to a doctor appointment, they'll render the service. They'll give me the service. After that, they will send a bill to the insurance. So that is your claim. That is the claim that they are owed that money, right? After they send the bill, the insurance will receive the claim, so they will receive the charge from the provider, and they're gonna do all the math that we talked about: deductible, copay, maximum out of pocket. They're gonna figure out discounts. They're gonna see if the provider is part of the network. If it's not, then they're gonna send you a bill, right? So depending on the provider, depending on your HMO, like your health insurance company, like the bill might take like 3 or 4 months to get to you. And the company, they're gonna, like the provider, they'll get their money like 6 months later. Like it takes forever. So the doctors have to factor that in when they are figuring out prices. So I never know exactly when I have to pay my bills. Like, so I go to the doctor today and I think, oh, I need to save money to pay this. I don't know when, because like it might take forever to come. We're going to come back to this later. So finally, as I was just talking to, like the patient responsibility, they're going to do all the math there, and they're going to send you a letter with how much you still have to pay. So let's go through a practical example so these numbers make a little bit more sense. Before I do that, is it making sense so far? Like the levels of limits we have, the things we have to think about? Is this making sense? Or is it very confusing? I left some things out, and I'm gonna add them later, and it's gonna be a little bit more confusing still. Yeah, it's a little different than Brazil. Okay, so let's keep moving. So here's the configuration, as I called it, right? I'm gonna show, like, once we're done with this, I'm gonna go to my personal plan, and I'm gonna show you my numbers, but this is just one example for us to walk through the logic, right? So let's assume that we pay $300 per month in premiums. This is not a crazy amount, right? So this is kind of what I pay, I think. And this is the, I didn't put in the slides, but let me make that, let me pull up a notepad here real quick. So I pay, let's say 300 a month. If I were to pull my Olerite, which is the pay stub, in there, my company would kind of show me how they pay this per month. Actually, this is the total cost. They pay $1,500 and they leave me to pay $300 per month. So if you were one of those people who do not work and do not qualify for any other programs, you would have to pay kind of this, more or less this amount, depending on your family, right? In your needs, your age. So if you go look like in the marketplace, you see people paying anything from like $1,500 a month to, I don't know, $4,000 a month. So if you put this in 12 months term, right? Let's go with the smaller amount. We have, I'm not gonna do math here. I'm gonna, in my head, I'm gonna do, okay, 18,000 a year. If we take the minimum wage, right? Let's see how much that is. So the minimum wage would be about 15,000 a year. So if you make, just so you understand like the how tough this is, if you make minimum wage, it is virtually impossible unless your company helps you. And if you're making minimum wage, usually you're working per like hourly, so they do not offer benefits. It is very unlikely that you can pay for private insurance. In this case, you're screwed, right? So let's get back to the slides here and keep going through the example. So $300 per month, the deductible being $1,500 a year, right? So all these numbers, these limits, they are per year, right? The co-payment for a visit is $25. So again, going every time I go to the doctor, I either pay the deductible or the copay, depending on where I am in my journey to pay the full deductible. Then, once I hit the deductible, co-insurance kicks in, and I pay 20% of everything until the maximum out-of-pocket, which is, for our example, $5,000, right? So this is kind of the configuration of our insurance plan here. So, a real scenario. Say that during 1 year, this is what happened to me, right? I went for a routine doctor visit, and the price for that was $200. Then, because of that, I had to go to a specialist doctor who charged me $400. On top of the consultation, I had to pay $300 in tests or exams. And then I needed to do a surgery that cost me $8,000, right? Let's see how much I spent in the entire year if this is what I had to do in this specific year with my insurance. So monthly premiums, like I said, $300 per month, and regardless if I use it or not. So per year, I'm already looking at $3,600, right? Out of the door, like without using or using, I'm already like $3,600 poorer. Then I went to the doctor the first time that charged me $200. Remember that my deductible was $1,500 or $1,500? Since I didn't pay anything towards the deductible that year yet, I had to pay for the full $200. That puts my deductible at $1,300 left, right? Then I went to the specialist and it cost like $400. My deductible was in $1,300 after the first visit. So now I still have to pay those $400. And that gets subtracted from my deductible which is now sitting at $900. Then I had the lab tests, which is $300 more. My deductible was $900 last time we checked after we left the specialist. So those $300 still have to pay for the whole thing before my insurance helps me. That leaves me with $600 still left in deductible to pay for. Finally, I go and do the surgery. But since I have copay, actually in this case it's co-insurance of 20%, I have to pay $1,600 of those $8,000. You're still with me? So the whole cost for the whole year was $3,600 for the premiums, $1,500 for the deductible before the insurance helped, $1,600 in co-insurance and co-payments, and my total out of pocket without the premiums, right? Because that doesn't count, was $1,500, which is the deductible plus the co-insurance. Actually, it was $1,500 from the deductible plus $1,600 from the co-insurance. So I paid the $3,600 plus $3,100. So technically, in that year, I spent $6,700 on healthcare. But remember that our maximum out of pocket was $5,000. So if we go back and we take that into account, I actually spent 36 plus the 5,000, right? So in that year, me having insurance and going through like a bunch of stuff, it actually cost me $8,600 or $8,600. So in this scenario, after, like I said, we reached the maximum out of pocket, everything else, so let's say that I were to have another surgery that would cost, I don't know, $10,000, right? The next surgery would be free because I have reached my maximum amount of pocket, my maximum amount out of pocket. Does that make sense? I want to pause here and maybe let you guys ask questions if you have, because I'm going to go one level deeper that might make things a little blurry again. So I want to make sure that like the system here is kind of clear of how it works. And I'm going to go through this again, right? So we started paying just $300 a month. We went to the doctor and that cost $200. But since my deductible still is not met, I pay for everything. That leaves me with a deductible of $1,300. I go to a specialist, I pay for the whole thing, so $400, because my deductible haven't been met yet. So that is that leaves me with $900 still to pay before insurance helps me. Then I do the lab tests, which is $300, leaves me with $600. Because I think this is wrong, because we still had $600 in the deductible, but maybe I did something wrong with the math here. But anyway, the point still stands. I go do like a surgery or something, I have to pay 20% of that, which is $1,600. So my total cost for the year is premiums $3,600, deductible $1,500, co-payment $1,600. That would put me at 60, I think it's here, right? Yeah, 6,700. But my out of pocket maximum is 5,000, so I would end up in 8,600 for the year. Okay, since we have no questions, I'm gonna keep going, and it might be useful, like we might get more clarification as we move forward. I think I'm gonna get out of script here. Okay. So before I get out of script and go into my personal life, there's a couple things that I want to share. So how much is it going to cost? So let's say that you need to go to a doctor, right? Like take a test. And you want to know how much is it going to be before you go in, right? So you have an appointment, you get there and say, look, how much is this going to cost? The answer is, I don't know. There is no way for you to actually know how much it's going to cost before you do the work. And this is why it is a terrible system. It's very complex, because if you got anything, if you were able to absorb anything that I shared, right, there's the step where the claim goes into the insurance, and they have to go and calculate, oh, who are you? What plan is this? Who's the provider? How much have we negotiated with this provider for a discount? So this is all internal information that the insurance company has that is not available to the provider at the time of service. So the provider cannot give you a number before you do the service. So this sucks. Every time we go like do something, I know that I'm gonna have to pay something, but I don't know how much that something is gonna be. What I know is that it's not gonna be larger than my maximum out-of-pocket money, because as we learned, the maximum out-of-pocket is the maximum amount that I can pay in a given year before everything else is taken care by the insurance company. So this is the answer to your question, Anna, is whenever we reach the maximum out-of-pocket, the insurance company pays everything, right? So this is much simpler in Brazil, at least as I remember. I mean, in Brazil it's much simpler. So in Brazil, you pay like however much per month, and wherever you use, it's free, essentially, right? The insurance company covers the cost. Here, that's not the case. You're always paying something. So unless you have a co-pay type of plan in Brazil, which last I learned, it wasn't very common. And the people who had it, I think it was a fixed amount. So if you went to like a doctor, simple, like generic doctor, it was, I don't know, 50 reais. So you kind of knew how much you would pay. In this case here since in the US, copay and coinsurance and all that stuff can be in percentages. You never know what that's going to be, because the percentage is going to be applied on top of whatever discount a provider will give to the insurance company, right? So it's essentially impossible to know how much you're going to pay in advance. So let me flip my screen, and we're going to take a look at my insurance thing. So let me just open it before I share, make sure I have everything ready. Just give me a second here. Okay, so please load. It was loading before the transmission, and then it stopped, and then it stopped again. I strongly dislike this. Let me try again. Oh, Jesus, like the system that I need to access is not working. Let's see if it does now. Why? Worse. Ah. Okay, I'm gonna try in a different way. Hold on. I'm getting there. Please do not hang. Your call is very important. Okay, so almost there. I promise. You can come up with questions while I do this. And it doesn't work. You log into the thing, and the thing logs you out. Let me try with another browser. Okay, so let's see if it works in a different browser. This is very interesting. Like, you're gonna like it. I hope I can make it work. Okay, almost there. Fingers crossed. Fingers crossed. It's gonna work. It's gonna work. Yeah, it worked. Cool. Okay. Oh, it didn't. Why? Yeah, okay. Why? Work. Please work. We're gonna make it work. See, it's loading. and then it redirects me to the damn thing. Okay, let me try one last way. I strongly dislike this. Just give me a second, guys, because this is gonna be very important. No. Okay, so I'm gonna switch it to myself. Just give me 1 second. I am still not out of ideas yet as to how to make this work. So, okay, so I'm gonna get a text to my cell phone with a code that I hope helps me log in so I can show you my dashboard, because there's one more dimension that I want to explore. Please work. Please work. It doesn't freaking work. Why? I was just able to access it before. Why? Okay, I have another idea. So I'm trying to show my current health insurance, which we changed this year. So I'm gonna go in the previous one, because the previous one was good and the system works. So you see how this is a problem already? Like I have this, like my Sul America. So I used to have Cigna. Now I have one that's called Aetna. Cigna system was really good. Aetna, not so much. So let's see if I can log into Cigna and show you something from last year. I apologize, guys, for this not being a little bit more straightforward, but I wasn't counting on the thing not working, which I should have. So coverage, home, how do I do this? Okay, so let's see, last 24 months for me. Cool. Okay, so this is, I think this should be helpful. Let's see here. Let's hope that I don't share anything that is terrible. Okay, so guys, can you see my screen? So, cool. So I'm gonna try and give you some overview into this. This is interesting to see. So I was just talking about the life cycle, right? Like how long it takes. So you see here that like for the provider, so I go to a provider to get a visit, right? Between the provider and the claim being submitted, so the insurance company receiving the charge request, is like between 1 and 15 days, or it can take up to 6 months, right? After the company receives the claim, they usually will process and kind of pay it or let me know how much I owe, like between 1 and, I don't know, like 3 and 15 days, right? So it's very fast. Let's look at the numbers. So I think this is prior year. Let's filter for a whole year. Okay, cool. So last year, right, the insurance company was billed to $18,000, almost 19. I paid almost $2,000. So that will be kind of my deductible thing. But it's not really that. Let's look at my therapist here. Okay, so this is the breakdown. So my therapist, it was in network. So this is the guy I see. You have his address, his phone number. You can call him. And what happens is he sent the bill to the insurance company for $265. My insurance has an agreement with them, right, with this provider, that gives them a discount. So if I pull up the calculator, right, they charge $265, but because they want to work with my insurance, they give a discount of $200. So really, the provider gets paid $62 for providing services to me, right? Of those 62, my insurance decided to pay 22 and left me with 40. So every time I go to the therapist, I pay $40. Here is the thing, and this is, I don't know why. Oh, cool. So we'll see here that is telling me how much of this money that I paid went towards my deductible. And it's telling me that it was zero. And here's why. This insurance company treats therapy as something good. Since it's good, it doesn't count towards the deductible, and I don't have to pay deductible for this. So I pay a fixed amount of copay. So let's say that I were to go to a therapist that was, I don't know, $1,000, right? With this system that they have, I would only pay 40. They would figure out the rest, either by getting a discount or by paying it in full, and nothing would go towards the deductible. To me, this is more beneficial because I would only pay 40, right? So this is good for me. If it was like like if it was deductible, it might be that I had to pay like a few $100 until my deductible was met. So this is one example that I wanted to bring you, which is, let me go full screen here before, yes, because I want to show you guys something else. So we have the deductible, we have the copays, and we have maximum out of pocket. There's another variable in this, which is the insurance company. They might consider some things desirable, right? So for example, if you're doing like if you're, I don't know, 55 or 50, I don't know what the age is, and you go and you do like a rectal exam for your prostate, right? For men. So in those types of exams, they think it's good because if you do that early enough, you can find a problem that if you treat soon enough, it is cheaper to treat. So for you to go and do that, they just charge like a small amount and not something towards the deductible, because if you had to pay towards your deductible, potentially you could have to pay a lot of money. And if you had to pay a lot of money, you probably wouldn't do it. And then if you don't do it, you're going to find your disease later, which is then going to make everything more expensive for everybody. So in order to incentivize this type of things, they just make it like be a copay. So let me pull up something else here that I think is going to be interesting. As I do this, the other thing that I believe it's cool is, you see how much my doctor get out of the whole money? Like just $62. If I were to go there and do it in private, he would charge me $265. But since I'm going through insurance, he just gets like $60. So that is a problem, because that makes it even harder for people to do stuff on their own, because they don't have access to that negotiated amount. Let's see if I can get like a summary of the year. I want to see like the whole summary so I can show you like my deductibles and blah blah blah. Okay, so this is not active. Why is this not working? Yeah, I have the claim. Let's see if I can see here. So blah blah blah. No. Give me a second, guys. Strongly dislike this. Oh, he worked and then he didn't. Anyways, it's like I cannot find this on the old one because it is already kind of gone, you know. But the point I wanted to make is, even though my whole deductible is not met, I still don't pay a lot for everything, and that's because I have a good insurance plan, if that makes sense. Because a lot of the stuff that we do is covered into preventative care. So for example, if we go, let me see if I can get like one of Benjamin's bill, so you guys can take a look at what it looks like. So let's see something that I made. I paid a bunch. So I think this is the emergency. Is this the emergency? Yeah, I think this is the emergency visit. So you guys take just can take a look at. So if you follow Erika on Instagram, you know that like last year Benjamin had a couple of episodes of seizures. Once we had to take him to the ER, right? So if I am not mistaken, ER visits, depending on your plan as well, so that's how it works on mine, they are also not charged as part of the deductible. Usually if you go to the ER, it is paid, you just pay a fixed amount. In this case, for ER visits, it is $200, right? So Benjamin was seen by a doctor at the pronto-socorro emergency room, and the hospital charged $691. They got a discount, as we talked about, of 124, which was had the insurance left with 566. The insurance paid 366, and I paid 200. So in this case, the insurance helped me, but this is because I have a good insurance. If I had a bad insurance, most likely this would not be a fixed fee of 200. It would be a percentage of the whole thing. So say it was like, or even the whole thing because my deductibles were not met. So if this was a regular insurance, let's say not a good one, I would have to pay. I would only benefit probably by the discount from the network, but I would have to pay for the whole thing because my insurance, if it was bad, it wouldn't treat this. It wouldn't have me the option of just having like a copay. If we look, let's see if I can see something along these lines too. Like there's a like $50. Okay, so this is another one that we kind of did emergency visit. So, but it was not emergency visit, right? So I don't know in Brazil how it's currently working, but if you need to be seen now, where can you go in the private sector? Usually it's the pronto-socorro of a hospital, right? In the US, we have kind of 3 tiers of urgent care. There's the emergency room, which is the most expensive one, right? That's like when you get shot, you get like you really need help with stuff. In Brazil, I think it's the pronto-socorro. So this is the most expensive. For me, I can go there if I just be seen, it's $200. Then there's the emergency urgent care, as we call it. In this case, it's $50 fixed that I go. They have like a general doctor. They can do x-rays. There's not a lot they can do. So that's why it's kind of cheaper. They can do like maybe a simple blood exam, like urine sample. That's the kind of thing they can do in the urgent care. So that's $50. So we've seen 200, we've seen 50, and then we can see here the $20. So if you go to the clinic, I think is just we call it, it's $20. But all they can do there is like they have like a very basic doctor or a advanced nursing, a nurse, advanced, and they can do no tests. There's no exams. So if you have a flu, instead of going to the ER and spending the resources that could be used to treat like more complicated cases and pay more money, you just go to a regular clinic, walk-in clinic, and you pay $20 and like you are seen by a less equipped doctor, let's say, but you can still get help, right? So there's like these 3 tiers where depending on the criticality of whatever it is that you're feeling, you can choose. and that is going to dictate what kind of care you have and how much you're going to spend. So let me take back to me here. Okay, we're going towards the end. Let me take a breath. So I know there's a lot, and I still don't know everything about this, because like there's even like I just kind of touched like private insurance, right? There's the programs. Every one of those types of those programs and types of insurance that I shared, like HMO, PPO, EPO, POS, each one of them are gonna have different rules. So you get this whole thing where there's a bunch of rules that can vary depending on the type of plan you have. There's things that vary depending on the program you're enrolled in. There are things that vary between insurance companies and their offerings. There's a lot of complexities in the claims process, which is submitting the charges, getting discounts, figuring out if it's in network or out of network. There's all that. So this is the reason why they say that the American health system is broken, right? And there's more, like as we mentioned, and we touched very briefly. Private insurance, very expensive, right? That's why not a lot of people have healthcare, because it's either very expensive, so not a lot of people can afford, or it's really tied to your job because the employers pay a bit towards your premium, towards your health insurance. So it really leaves you with very limited choices in terms of what you can get access to. And it sucks because there's no public infrastructure. What we have for public, but it's far from good. It's my last slide here, which is this one. So what happens if you're illegal, right? So I think last time we talked about this. That's kind of how we got into this class today. Is if you're illegal, it means you're not working, right? If you're not working, it means that most likely you're not gonna have private insurance from working. If you're illegal here, it probably means that you do not have a lot of money, because if you had money, you would be legally here. If you don't have money, you're also not gonna have access to private insurance that you pay for yourself. That leaves you with a very limited list of healthcare choices in the US. So you can pay cash, right? Which we saw, like the amounts of money is very high. So because you don't have the insurance discounts. So as the example of my therapist would be like $265, right? So you can do that, but as we established, if you don't have money, you don't have insurance, you probably don't have money to pay for this as well. So you don't get access to therapy or any optional, let's say, or less critical types of care. You can rely on some states that have some programs for some people, right? So let's say that you are disabled and you live in a state that doesn't care much about illegal immigration. They don't check your status. I don't know, California. That is one that comes to mind. It's possible that if you're a disabled illegal immigrant in California, you would have access to healthcare, but I wouldn't count on it to move here, right? So the only thing that everybody else has access to, if you're legally here, if you're poor, if not, it's emergency services, right? So if you go to the ER and you have a broken arm, they are required by law to treat you. But what's going to happen is you're going to leave the hospital with a big bill. So you're going to be owing money to the hospital. You might never pay. They might not never get the money, but you owe them the money, you know? The problem with that is it doesn't give you access to further care. So say that you broke your arm, you get it fixed, right? But now you don't have a follow-up appointment to remove the thing. So how do you do it? I don't know. I have no idea. If you need some sort of medication or treatment, how do you buy that? I don't know. Because here's the thing that I didn't mention in the whole hour we've been together is that buying medication without insurance is also very expensive. So insurance here, I know that in Brazil this is becoming a little bit more popular. You can use your insurance to get discount on medication. Here, if you don't have insurance, medication is really, really, really expensive, right? I don't know if you heard, but people that need insulin that cost like 10 reais in Brazil spend like upwards of like $1,000 a month in insulin here, and they have insurance. It's just because of the legal system and the way the patent system works, so it's very complex. I'm not gonna go into that. But without insurance, you're screwed. It's very much screwed. The other problem, on top of the further care that might be required, is that let's say that you're building like a small emergency fund for savings, right? And a car hits you, and you need to go to the emergency room. Now you leave that place owing like $5,000. So the little, like the $1,000 you had, now you have to go and put towards paying the medical bill, and you cannot save anymore. So you have no other money, and any additional income that you make that you would use to better your life now needs to go in paying that debt. So that is not uncommon for people to go completely broke if they face some sort of medical problems. So poor people, they are not so poor that they don't qualify for the free stuff, the government programs, but they also don't make enough to get private insurance through their own or through a company. So they are really in limbo. That's where a lot of people that get hit with some sort of disease or illness are really like they cannot get off the ground anymore for years to come because they are full of medical debt. And if you have medical debt, you cannot not get a loan to buy a house or a car. So life is really tough, you know? So that is the extreme downside of this system. Just not everybody has access to this, and that is terrible because healthcare is very basic thing that humans need, and unfortunately not everyone has it. But on the other hand, right, just to kind of offer a light at the end of the tunnel, this system has enabled most of the health advances we have in the world today, right? So I think more than 80% of the advances we made in health, in treatment, right, for cancer, for heart disease, like whatever it is, has been developed in the US. The US is by far the country that pushes health science to the future because it is a private system and companies make a lot of money doing this. So on the other side, we have the upside of being developing a lot of science and a lot of treatments for these things. Brazil is a good kind of system because you have the public support, and you also have the private, which is, as far as I can tell, declining, both in quality and going up in price. But it's still kind of, you have the choice. On the other hand, you have like countries like Canada, where it's completely free, like in Brazil, and is universal, but you don't have the private part. So the quality is very low and wait times are very high. So I have a friend who recently moved to Canada, and his son, he's two, same age as Benjamin, he felt, and he made like a pretty big cut here. And he went to the ER, and he was told that he was going to have to wait 13 hours to be seen. So he decided to go home and figure it out. Like, his mom is kind of a nurse, so he called his mom in Brazil, and they did a gambiarra to kind of suture the opening that like, he was supposed to get stitches, like a suture, like 5 or 6 stitches, given the size, but they used like a bandage or some other stuff to put the cut together and heal. I have another friend that is a co-worker who's from India, and I think he had a problem with his tooth. He lives in Canada as well, and he said that he was gonna wait until he went back to India to visit, to see a doctor about his issue, because I think the wait time in Canada where he lives is like 6 months, and that's what you have to do. Like that, like, you wait. That's why there's a lot of people who live close to the US, or even people who are not so close but they have some money. They'll fly to the US to get medical care because they cannot get it in Canada. So it's a tough problem. There's no easy answer. If you prioritize universal access, you got poor quality, or even worse, and long wait times. If you prioritize quality and wait times, the cost goes up. So it's always an equation, like accessibility, cost, quality. There's models in the world that talks about this triad, and you can usually have 2 of these 3, right? So you have to pick between 2. You have quality, accessibility or universality, and wait times, I think, and cost. Quality, universality, and cost. You can pick 2 of these 3, right? So in Brazil, it's universality and, let's say, quality. No, universality and cost, because the quality of the public stuff is kind of low. In Canada, you also have universality, and the cost is low, but again, quality is also low. In the US, you have high quality, and you have maybe the cost is kind of accessible, but it's not universal. So it's an equation where you cannot have the 3 factors. You can only have 2. So countries have been experimenting and trying to figure out what works best for them. And that's where we are. Okay, so I'm looking at the chat, and I see no questions, which tells me that, but I also see like most of the people who were in at the beginning, they're still here. So you either sleeping, you either understood everything, or you understood nothing and you don't even know where to start. I don't know what to make, because there's no questions. So I'm going to take another breath. Like, I know we're 17 minutes past the hour, but I wanted to make sure that we had time to cover everything. And if you still have questions, you can send them. And I'll try and answer in the next few minutes before I let everyone go. But if you want to go, I appreciate you being here with me, and you're free to go. We're just going to go through some questions if they come up. And I'll just stay here for a couple more minutes and see if we have questions. So if you want to go. If you want to stay and have a question, you can stay too while I have a sip of water. Did you guys like this? It's complex, isn't it? It is so expensive, yeah. So as we're doing this, I really wanted to share with you guys my numbers here, but I unfortunately I couldn't get access to it. Like, I was really wanting to do it. Like, I mean, I shared some of it, but I wanted to show you like the whole. I could show here in the phone, but it doesn't cover the thing, because like in the phone it's like I just changed to a new plan, so I don't have any spans here. Yes, Anna. So, as everything in life, we have the positive, the upside, and the downside. My recommendation to you, if you're ever thinking about coming to the U.S. without a valid immigration status, think twice because you're gonna be getting like your health is it's gonna be there's gonna be a severe risk of you having problems with your health, especially if you're older, right? You're not gonna have access to decent health care. So think twice about immigrating illegally to the US. And if you're doing it legally, consider the implications, right? So as Brazilians, we take for granted because we assume that we're gonna have like good health insurance. You think it works like it does in Brazil when it doesn't. So it might be expensive even if you have some sort of health insurance. This is the other side that TV doesn't show. Is yeah, it doesn't. Like it's very. I don't know any shows or even movies that talk about this. So that's right, Veronica. Like it's like we're made to think that it's very easy. But let's see if I can. Like I don't know, but I think that when we had Benjamin, even with insurance, and I had a good insurance. I think that year we spent close to like $10,000 in medical bills because that was like our maximum out of pocket. And there's a lot of nuance to this. So my deductible is my thing. Erika's deductible is her thing. So she can meet the deductible while I don't. Like maximum out of pocket is shared for the family. So there's like a I think the whole bill for Benjamin to be brought to this life was I think $67,000, something along those lines. And I think to us it was like I think we spent like 10,000 or something because that was like our maximum out of pocket. Um, so can Valerio has a question. Can foreign students use the UL's healthcare system? Yes. So there's some nuance to this. Like there's cases that I didn't cover. So for a student, you would buy a travel insurance that is kind of a student travel insurance, and usually the price is okay. I think it would be on the range of like I don't know 100 to 300 or 400 a month, which is high but still doable, right? And the reason is like students they are usually young people, and the insurance would be very close to what you guys are using in Brazil. So you would pay like 300 or 400 a month, and there would be probably no copay, co-insurance, or anything. That would be like, okay, you pay this fixed premium, and it's kind of free after that. Tourist is the same thing, Anna and Tami. So you do like a travel insurance. So for example, whenever our parents come to visit us, like either mine or Erika's, we buy like a travel insurance for them. And if we need them, like we call the insurance and they either gonna tell us to go somewhere, or if we need to go to the emergency room, we go there, we give the insurance information, and they bill the insurance company. So there's no copay, co-insurance, nothing. If you're traveling, if you're in a temporary student visa, it's a little simpler. You just pay the monthly premiums, and that's it. If you're a more permanent or like a temporary worker, that's where all of this stuff that we've been talking about applies. Thanks, Igor. Thanks for coming. Wish you a good night. Yes, so Veronica, it's cheaper for the whole family. So usually the scale is kind of it's I don't know. I'm just gonna make up numbers, right? It's like 100 for me, is 150 for me and my wife, and is like 180 for the whole family, however many kids I have, right? So let's say that I had 3 kids, it would be 180. So if you're single, it's cheaper. If you have just a spouse, it's a little bit more expensive, but it's not as expensive as if you had like the whole family insured. Um, So Anna, you're right. Usually when you're traveling, even if you need medication, I think that varies between the travel plans you get, but I don't think the medications would be covered under the travel plan. Just the doctor, visit, hospital, treatment, whatever. But if you have to go to the pharmacy and buy something, I don't think that's included. But I could be wrong. I'm not sure. But in general, it's just, as far as I can tell, it's just for the actual medical expenses and not for treatment and post care medication. Because the intent of a travel insurance is not to treat you, is just to stabilize you, right? That you're good enough so you can come back to your country and get treatment in there. It's so much that they will even pay for your extraction if that's necessary. And it depends on the travel insurance. Anyways, any more questions? Any more questions? Cool. So let me just make sure that I'm scrolling here, that I didn't miss anything. So yes, the US is very expensive. Anyways, I think I went through everything. So that is it for today. I hope that you guys learned something new. I hope that it was entertaining. I hope it was fun. And that is it. I guess we'll see each other again in another month. And before I say goodbye, let me pull up like another song here. Still from Linkin Park. So thanks very much, guys. Please leave suggestions for our next class in Hotmart, I think. If you have suggestions, again, it's always welcome, because I never know what I'm going to talk about. And I'm very eager to know what you guys want to learn, so I can also learn about that topic and come and share a little bit with you, because that way we all get a little bit smarter every time. Okay? So you guys have a good night, a good end of your Monday, and I hope you have a fantastic week. Bye-bye.
All these shows, you know who you are. Love you guys. Got a long way to go and a long memory. I've been searching for an answer, always just out of reach. Blood on the floor, sirens repeat. I've been searching for the courage to face my enemies when they turn down the line. I hear my battle symphony, all the world in front of me. If my armor breaks, I'll fuse it back together. Battle symphony, please just don't give up on me. My eyes are wide awake for my battle.